We're going to talk about heat-related illness. This is a really general discussion. It's going to get technical in a couple of places, but I really wanted to give you an overview and kind of a sketch of what heat-related illness is about. I am not trying to present information on how to do technical types of treatment or diagnosis for heat-related illness. This isn't a presentation that is geared towards providers. It's geared towards adjusters and nurses and the general public. I will discuss how the body regulates temperature. I'll also discuss, this idea of heat-related illness as a continuum for benign conditions to more severe and life-threatening conditions. And then one of the things that I want to talk about is some of the sequelae that we know, some of the things that happen after you get over your heat-related illness, and what those things can mean for you long-term. So as far as thermal regulation, or the ability to maintain your body temperature, first thing you need to know is what is core body temperature. Actually, what we consider to be your core body temperature is the temperature in your chest and abdomen. And what we consider to be the maintenance of core body temperature is simply being able to keep your temperature within a set range. And, we generate heat by eating calories, and we also get heat from our environments. But we also have this way of losing heat when we have too much. Either we've eaten too much or the environment is too warm for us. And what our body does is maintain that balance so that, we balance the amount of heat we're generating internally and absorbing from the environment with what we're losing to the environment. And all of that control is based on the function of a really small area of the brain called the preoptic nucleus. And this is the anterior hypothalamus. I'll show you a picture of this. And basically, it stimulates these nerve fibers that control your autonomic nervous system, and they open up your pores and they cause you to sweat. So here's a fancy neuroscience kind of picture. We have the cutaway of the brain on top. And you can see that there is this the cerebral hemisphere here. This is the medial part of the right cerebral hemisphere. This side here is the front, and there's the back. I want you to remember this area here. This is the cerebellum. The cerebellum is actually pretty sensitive to heat-related illness. We're going to talk about that later. This area here is the hypothalamus. And this little guy here is the pituitary gland, and we're concerned about this area here in the hypothalamus. And if you look at the lower depiction, you can see the hypothalamus, and here the front part of it, or the anterior hypothalamus, and then the posterior hypothalamus. And then if you break down the hypothalamus into all these nuclei, it's this lozenge-shaped green area here. That's the preoptic nucleus of the anterior hypothalamus. And that little thing, which is probably the size of a gummy bear, probably a half of a gummy bear, that's how small this area is critical to maintaining body core temperature. The way we principally maintain body core temperatures through sweating, through evaporation. And that's how we lose heat in a hot environment. But if relative humidity gets too high, we can't lose that heat. It doesn't matter if you're sweating, you're still not going to evaporate the moisture that is released to your skin. There are a few other ways in which you can actually lose heat. One of them, which is somewhat important, but not really, is radiation, and that's direct infrared radiation from your skin to the environment. Another is conduction, which is the direct transfer of heat by a physical contact with a cooler object. And then a third is convection, and convection is basically air taking heat, moving air taking heat from your skin. Conductive cooling really occurs. You can make an example of it is put an ice cube on your skin. The area where your skin gets cold, that's because conduction is taking heat from your warmer skin to the cold ice cube. Again, blowing air across your skin is a way of doing convective heat loss. When heat transfer stops, your core temperature begins to rise. As I said earlier, evaporation is our main way of cooling. If your perspiration is not able to be formed, then that's from dehydration, or you have perspiration on your skin, but the relative humidity is high enough, you're not losing heat, even though your skin is becoming wet. There's a physical chemical kind of a relationship between how things move from an area of higher density, whether it's heat or energy or whatever, to an area of lower density. And in this case, it is when there's high enough humidity and high enough temperature, the heat wants to stay in your body instead of being released from your body as you perspire. Atmospheric moisture content, or the relative humidity, is the most important factor in this. This is one of the things where we kind of get a pass in Montana because we live in such an arid environment. But if you live in the South, and particularly if you live in the Deep South, or if you're in the Caribbean, Southern Mexico, Central America, places where it's really humid, this becomes a really important factor. There's two ways to measure ambient temperature and take into account humidity. One of them is the hard way, and the other one is one of them is the hard way, and one of them is the easy way. The hard way is what's called the wet bulb globe temperature. And what this does is it takes into account not only the temperature of the air, but it also takes into account the relative humidity, the wind speed, the sun angle, and the cloud cover, which is solar radiation. The wet bulb measures the temperature read on a thermometer that is covered by a wet cloth. Usually it's cotton. They can use polypropylene. And then as water evaporates from the cloth, it cools the thermometer. And that gives you a measure of what the human body cools as it sweats. The black bulb temperature is a measure of direct solar radiation. So that's radiant heat from the sun heating up that globe thermometer as well. And this is kind of a cartoon of what a wet bulb globe temperature device looks like. They can be quite large or quite small and portable, and they have an internal computer that allows them to do the calculation to give you the actual wet bulb globe temperature. Here's an example of how wet bulb globe temperature is actually calculated. Again, this requires special equipment. If you have an air temperature of 85 degrees, and the natural wet bulb globe temperature is 78 degrees, and the black globe temperature is 115 degrees. I think you can see you take 10% of the air temperature and you add it to 70% of the natural wet bulb temperature, and that is added to 20% of the black globe temperature to derive your wet bulb globe temperature. And so as you can see, if we have an air temperature of 85 degrees, and we go through this calculation, the wet bulb globe temperature is actually around 86.1 degrees. So this is kind of a way that you can do it if you have that equipment, but there's an easier way that has an even more complicated formula, and that's the heat index. And the heat index is a direct relationship between air temperature and relative humidity. That's what we call the heat index. And I think everyone can see this heat index formula. It's really complicated. And who would want to do that just by knowing? Of course, you have to know the air temperature and you have to know the relative humidity. And if you have a computer, I guess you could crunch these numbers. But there's an easier way that a lot of big organizations have done for us. They give us these heat index tables that we can just look at. And with those, here we have on the y-axis relative humidity. And then on the x-axis, we have temperature. And all you have to do is read what the relative humidity is and then read across for the temperature. I want you to notice that there is a light yellow area, kind of a dark yellow area, an orange area, and a red area. And these correspond to the different extremes of heat index and what their consequences can be to us as people. So in the area where it's light yellow, caution, it's up to 90 degrees heat index. Remember, heat index again is looking at a combination of the temperature and relative humidity. So in this area here, up to around 90 degrees, which could mean 100% humidity at 80 degrees temperature, you are basically at risk of perhaps becoming, a little bit of heat cramps, and you're going to get fatigued, especially if you're physically active. You have to be cautious, keep yourself hydrated. With in the area of extreme caution, up to 103 degrees of the heat index calculation, now you are in a higher risk for heat stroke, heat cramps, and heat exhaustion, especially with prolonged exposure and or physical activity. When you're in the danger zone, now it's likely that you will at least have heat cramps and or heat exhaustion. And if you stay out in the sun, despite those symptoms, you may develop heat stroke. And then with a heat index of, in the red zone, you're at a heat index of higher than 125 degrees. Now you are highly likely to develop heat stroke. So when the heat load is lower than heat loss, you'll start to shiver. Basically, the environment is pulling the heat out of you, and you can't replace it by metabolism. And so you start to shiver. When the heat load is higher than your heat loss, you'll start to bake. Baking isn't a good thing. If you get too high a core body temperature, you'll develop a thing called hyperthermia. And this is defined as a temperature outside the normal range. And the normal range is somewhere around 96.8 to 99.5. But when you get around 104 or 105, now we're into the zone of extreme danger, severe hyperthermia. And severe hyperthermia is one of the things that we look for in someone who may be suffering from heat stroke. So when the heat load is higher than heat loss, you start to bake. And if you bake too long, bad things happen. So I'm not going to go into some of this data because you can read it here and it will be in the notes. I just want you to know that there is a problem with exerting yourself in a high temperature and high humidity environment, and that kind of everybody is at risk, especially with exertional heat illness. People that are at risk are athletes, and it doesn't really matter if you're young or old. Structural and wildland firefighters are at extreme risk of exertional heat illness. Military personnel that are out in the field, in the tropics or in desert environments, construction workers, typically working outside and in non-air conditioned environments, and obviously agricultural workers. All of these folks are at risk of exertional heat illness. But there's this non-exertional heat illness that is also a factor. And there are a number of groups that are at risk to developing this. Again, extremes of age. And again, extremes of age means the very young, not just the very old. Pregnancy is also a risk. Obesity, poor physical conditioning, lack of acclimatization. So the person that is from the southern hemisphere, where it is winter right now, and flies to the northern hemisphere where it is summer, will not be acclimatized to summer temperatures, and they are at increased risk of non-exertional heat illness. If you don't have air conditioning, that's a real problem. Social isolation, the very elderly who are living alone and perhaps in an apartment or in an environment where they don't have access to air conditioning. This is something that happened, I can't remember the year, when there was a huge heat wave in Paris. And A lot of people were found dead in their apartments, elderly people with no air conditioning, and they lived alone and no one thought to look for them. And they were found dead in their apartments from heat stroke. Dehydration due to lack of water intake and to replace the sweating, that will also increase your risk of non-exertional heat loss. Diabetes, cardiovascular disease, a lot of alcohol use, certain medications, illicit drugs, all of these can increase your risk of non-exertional heat illness. But I want you to kind of cue into this because this is kind of a work comp talk, or it's at least the audience is a work comp audience. You know, you want to think, well, gee, this is a disease, right? This is an illness, therefore it must be an occupational disease. But in Montana, an occupational disease is something that occurs on more than a single work shift or on more than a single day. But I think you can see from how I've described heat illness that it does occur on a single work shift. It does occur on a single day. And so even though it evolves and even though it can go from mild to severe disease, it is technically still an injury, not an occupational disease. Heat illness exists in a continuum. It ranges from benign conditions like heat cramps to life-threatening conditions like heat stroke. And benign conditions, if untreated, if you don't get first aid to that person, can become severe conditions and life-threatening conditions. So I want to present a case to you. This is a person that I saw as an IME. He was a 43-year-old male who began working as a restaurant shift lead cook in March of 2023. He was working 4 10-hour shifts per week, averaging 10 to 12 hours per shift. He was the only lead cook on his line. And so he was responsible for cooking basically all of the menu items throughout his shift. He worked there fine until around June 2023 when the temperature in the kitchen reached 108 degrees. They had a thermometer so they could measure it, and they had no air conditioning. And I think anyone who's ever been in a commercial kitchen knows that it isn't just hot, it's also very humid. There's a lot of water, a lot of dishwashing. It becomes quite humid in a commercial kitchen. He would become hot, sweaty, thirsty, lightheaded, and irritable. He also became nauseous. He said, I lost my place in my tickets. I lost where I was with respect to the order of his work. He did have water available to him while he was cooking on the line, and he consumed it. As his symptoms worsened, he said, I'd have trouble holding on to things. I'd feel so weak. He said he would then start to vomit or begin having dry heaves. He would leave the line, vomit or have dry heaves, go outside, try to get some fresh air, and then come back in and continue working. So there are 4 kind of recognized heat illnesses out there. I'm not going to talk about skin disorders such as sunburn and heat rash. That's not what we're going to talk about. We will talk about heat cramps, heat exhaustion, and heat stroke in this talk. Heat cramps, this is kind of the beginning of the continuum. It may be the first sign of heat illness. It's usually very painful muscle cramps, usually involving the legs. Associated with heat cramps is usually excessive sweating and flushed skin. It's related to not only the sweating induced dehydration, but also exertion and electrolyte loss. You know, basically what you want to do for heat cramps is get in out of the sun, start sipping water, eat salty snacks, replace the fluids and electrolytes, apply gentle pressure and massage the cramping muscle, and, you know, basically rest. Heat cramps on their own are not serious. They don't require any emergency medical care, but if they're untreated, they can lead to heat exhaustion or heat stroke. Heat exhaustion is the next condition, if you will, in this continuum. What happens is a person will develop heat cramps and fatigue and will start to sweat heavily. And these symptoms may be actually the first symptoms of heat exhaustion. Other symptoms that will occur will be lightheadedness or dizziness. They may become nauseous. They may begin vomiting. They'll usually complain of a headache. They also complain of weakness. If they do go to an emergency room or an urgent care, they might have medical laboratory testing. Their urine might be found to be dark and concentrated. They might have a really low specific gravity, which means it's really, really concentrated, very high. No, I guess it would be a very, no, high specific gravity, so very concentrated urine. They might have a rapid heart rate. Generalized muscle weakness is something that is always observed. But in this case, with heat exhaustion, usually the core body temperature is normal. So it's below that 99.5 degrees. Their blood pressure may be normal. It may be a little low, again, because of dehydration, but they're typically sweaty, their skin is cool, and their skin is pale. What you want to do in the case of heat exhaustion is move the person out of the heat into a shady environment. If you do have one available, move them into an area that has air conditioning. Lay the person down, raise their legs and their feet slightly. Again, it's kind of to help them from going into shock. Remove any kind of tight or heavy clothing. One of the things you want to do as far as removal of clothing is really get things off of them. Tight clothing, if you remove that, will improve convective heat loss. You'll get more air moving across their skin, which will help heat loss. If they have heavy clothing on and you remove that, you're improving their conductive heat loss, a direct transfer of heat off their skin. Again, because they're sweating heavily, you need to replace that fluid that they are losing from their blood vessels. So again, you want to give them fluids, but you don't want to have them drinking, chugging huge amounts of water or huge amounts of Gatorade. You don't want to induce vomiting from that. So you want to give them sips, but you want to get them sipping constantly. No alcohol, no caffeine. You stay away from that. Both of those are actually, in addition to a lot of other things, they're diuretics, so they will actually induce loss of fluid through the kidneys, and so you'll just complicate your dehydration by that. And basically keep that person cool. If you need to spray them down with a water hose, sponge them with cool water, or fan their body, fan their skin once you've gotten the clothes off them. And then basically you need to watch them until they're truly cooled down and truly stable. And then you don't let them go back into the heat. You get them out of there and they're done for the day. Heat stroke is it is the most serious heat-related illness. Heat stroke is kind of a real concern because it can cause not only death, but permanent damage to your brain, your heart, your kidneys, your muscles. There are a number of at-risk populations. And I've got a little cartoon over on the left side that shows some of those: outdoor workers, athletes of all ages, children, elderly, the pregnant. All of these folks are at risk for heat stroke and have to be protected from it. Symptoms and signs include, again, core body temperature that's way above normal, so way above that 99.5. When you're up to 104, 105, you start doing really nasty things to the proteins in your body, and particularly neurotransmitter systems in your brain. So one of the things you'll see with these folks is altered mental status. If you're lucky, they'll just be confused and agitated, maybe have slurred speech and be irritable. But if they are worse, they might become delirious, not know where they are, not know who you are, even though you're someone familiar to them. They may lose consciousness and begin having seizures, grand mal seizures. If they have severe heat stroke, they may lapse into a coma and be unarousable. You'll notice if you touch their skin that it's hot and dry. They're not sweating. We're beyond that. Their temperature is now going up much higher than would allow that. And there's an explanation for why they're not sweating, and that's because that pre-optic nucleus of the anterior hypothalamus is no longer working. They're nauseous, they may be vomiting, you may need to protect their airway if they are unconscious and vomiting by turning them on, lying them down and turning them on their side so that vomit doesn't go back down into their lungs. They'll have a rapid heart rate, they'll have shallow, rapid breathing, and if they are conscious, they'll complain of a severe headache. So what do you do for these people? You get them into shade or indoors, you get them into air conditioning. If you can, you remove every piece of clothing that you can from them. You need to cool them however you can. Although it used to be said that you didn't put them in an ice bath, now they know that putting them in an ice bath is really the thing you want to do. That's probably the best way to prevent, among other things, the muscle deterioration that can lead to one of the most serious complications of heat stroke. And so you want to put them in an ice bath if you can. Don't worry about putting them into shock. Spray them with a garden hose, sponge them with cool water, put a fan over them and mist them with cool water, get all their clothes off them. You want to put ice packs or anything cold around their neck, on their head, their armpits, and their groin. And then finally, you need to call 911. This is no longer a first aid situation where you can just deal with them on a first aid basis. Because of the consequences of heat stroke, they need to be sent to an ER where they can be monitored for those consequences because they are dire. So in my case study subject, he noted that as his symptoms worsened, he would have trouble holding on to things. He would feel so weak. Again, he would leave his workstation and then have vomiting or have dry heaving. And then he would go back to work on the line, basically re-exposing him to the heat and high humidity. He said that during this time, he also found that he was having blood in his urine. He also noted that if he got out of the heat, he would leave the restaurant to go outside, he would cool down, and his symptoms would improve somewhat. But then he would go back into the kitchen because he still had to work, and his symptoms would recur. And this is something you would expect in a situation where you're having repeated exposure to heat and high humidity. He had a 2-day bout of these symptoms and decided to go to an ER. He complained of weakness, paresthesias, numbness, the paresthesias or numbness in his hands and his feet. He was throwing up, he was feeling nauseous, and he also had this feeling of intense internal heat. He felt like his body was on fire. When they examined him, his heart rate was up. We consider to be a heart rate of 100 beats per minute to constitute tachycardia, a heart rate of 60 or less to be bradycardia. And I don't know why, but we've decided that normal heart rate is somewhere between 60 and 100. His heart rate was 98, so it's getting up there. But he was not febrile, which means he didn't have a fever. His temperature was normal, and the rest of his physical examination was normal. And so the ER just basically talked to him about fluid rehydration and then gave him Zofran for nausea. Zofran or ondansetron is a medication you can take if you're feeling nauseous. He went back to his primary care provider a few days later. I should mention that between these visits, he was still working. He was still showing up every day. And so re-exposing him to these heat and high humidity, this heat and high humidity environment. He went to his primary care provider, again complaining of dizziness. He was complaining of numbness in his hands and feet. He reported in the records what they described as brain fog, nausea, vomiting, diarrhea, and he is complaining of fatigue. He was not being successful remaining cool. He was drinking 3 to 4 32-ounce containers of water per day and still feeling hot. I think this attests to the contribution of humidity in his illness. He was hot, but he was also in a humid environment. And so he was, if you will, perspiring, but he was not losing the heat from perspiration because of the humidity in the environment. His physical examination at this point showed his skin to be warm and dry. Otherwise, his physical examination was normal. Remember about that warm, hot, dry skin, because that's something that's important. He was diagnosed with heat exhaustion at that time. He went back a few days later, again complaining of hand and foot numbness and tingling, but he also complained of forearm and leg and feet cramping. He was experiencing nausea, feeling of clamminess. Medical laboratory testing was normal. He was given a work release, but then just told to drink a lot of water and electrolytes during his work shift. Obviously, it wasn't working. When I evaluated him, he actually complained that my examination room was too hot for him. And the thermostat was set at about 72 degrees. But he kept saying, this room is too warm, it's too warm. He also reported to me that he found that he would feel too hot if he got anywhere above around 74 degrees. He said that when he was in a warm environment, he would become dizzy and feel flushed. And then he would also sometimes experience nausea and dry heaves. He also complained of hand and foot numbness, tingling, just like he had during his heat illness. His physical examination was really normal. I didn't notice any lack of, his skin wasn't hot and dry, but it wasn't sweaty or clammy or cool or pale, but I was in an air-conditioned room in my office in Billings. His physical examination was normal. We did some testing on him, and he did have blood in his urine. We did an abdominal CT scan, and he did have kidney stones. I diagnosed him with recurrent heat exhaustion, although I have to say that even though he had mainly the symptoms of heat exhaustion, with that warm skin and some of his other symptoms, such as the confusion, the irritability, the loss of ability to control his hands while cooking, the clumsiness, he was borderline heat stroke. Blood in his urine was definitely probably from the kidney stone. The other part of that, though, was that he had an anatomic variant in his kidneys, the way the kidneys connected to his ureters. They were not, it was an anatomic variant. It wasn't abnormal, but I couldn't tell if that was what predisposed him to kidney stones as opposed to having dehydration over, many weeks working that summer. And so I couldn't say that the kidney stones were work-related. Also, I couldn't say that they were work-related because there was only one small stone on, I believe, the left kidney. And I guess I would have expected him to have more kidney stones and for them to be bilateral for it to be work-related. So dark urine, this is a real bad thing. This is why you call 911 when you think someone has heat stroke. They need to be monitored for these kinds of problems. So rhabdomyolysis. Rhabdomyolysis is from a high temperature and prolonged exertion. It causes a rapid breakdown and rupture of muscle tissue. And the muscles, and these are your skeletal muscles we're talking about, they just die. And as they die, the muscle tissues release electrolytes and a thing called myoglobin. So everybody's heard of hemoglobin. That's what carries oxygen in your blood. Myoglobin is what your muscles use to carry oxygen in them. And myoglobin in your bloodstream is a bad thing. If you have blood in your, well, you're carrying blood all the time in your blood vessels. And, when your red blood cells break down in your blood vessels, that hemoglobin has to get filtered through your kidneys, it's no problem. But myoglobin is toxic to your kidneys and actually can cause severe damage to the kidneys. If left unchecked, myoglobin can cause kidney failure and result in the need for dialysis for the rest of that person's life. And so myoglobinuria is a life-threatening illness. We take that real seriously. The only treatment for it is to put a catheter in them and to give them bucket loads of intravenous fluids to flush their kidneys, to flush the myoglobin out. Cardiac arrhythmias can occur, seizures can occur, and these are usually due to electrolyte imbalances, again, from the severe fluid loss from perspiration. I'm not going to go into the details of this. This is kind of a detailed slide, but just want to point out that there have been a number of studies that have shown follow-up with military personnel who develop heat stroke fighting in the Iraq wars, and later on they found that they had a much higher risk of ischemic heart disease, much higher risk of ischemic stroke. So there are long-term consequences to developing heat stroke. Now, remember that one slide I showed you of the brain, and I told you this area here, this little area in the back, the cerebellum, is something that's really important for us. It turns out that the cerebellum is the part of your brain that helps you with coordination, not just with walking, but with doing things like reaching out to pick up a cup of coffee and take it to your mouth and not spill it on your shirt. Or the ability to do fine motor tasks. The cerebellum is what gives you the ability to coordinate, and also gives you the ability to coordinate the use of your right hand with your left, your right foot with your left, etc. And there's these fibers in the cerebellum called the Purkinje fibers, and they appear to be very vulnerable to heat-induced injury. This explains the clumsiness and the poor balance that you see in people who are developing heat stroke. Another thing that we see in the central nervous system is, again, this problem with the preoptic nucleus of the anterior hypothalamus. We know that you don't actually get damage to the preoptic nucleus, but mouse studies have shown a transient, a temporary disturbance in the preoptic nucleus's ability to perform thermoregulation. So we know that that's something that actually happens, at least in mice. Earlier studies reported this transient hypothermia. So after having heat stroke, you would have people that would have low temperature events, or they would have recurrent high temperature events. This was something that was observed, and just because obviously we can't just cut people's brains open and look at their preoptic nucleus. But they attributed those phenomena to damage to the preoptic nucleus of the anterior hypothalamus. We know now, again, from these mouse studies that it does occur, but it's transient, it's temporary. But this probably explains why the gentleman that I saw kept having these sensations of either being too hot when temperatures were really not very warm at all. It was probably this dysregulation of his preoptic nucleus. Other systemic effects of heat stroke, you can develop blood clots in the blood vessels, the mesentery arteries and veins that supply the stomach and the small intestines. Turns out it can exacerbate psychosis. So if you're a schizophrenic or if you have psychotic depression and you get heat stroke, it can exacerbate those psychological symptoms. Consumptive or coagulopathy for the nurses in the audience. Everybody's heard of DIC, disseminated intravascular coagulation, another life-threatening outcome. It's brought on by a lot of different conditions, but DIC can also be induced by heat stroke. Pulmonary edema or fluid in the lungs is something else that can occur with heat stroke. These are why, if you suspect heat stroke in a first aid situation, you call 911, because that person needs to be evaluated for all of these things. So my case study subject finally left his position as a cook. He still reported heat intolerance. He also would experience heat intolerance, and that would be associated with weakness, dizziness, nausea. He would have episodes of profuse sweating, and also with hand and foot numbness. I believe some of these phenomena were related to either dysfunction of his, the preoptic nucleus. I think some of that might also have been explained by still some problems with his cerebellum. The other side of this is that he did have a history of anxiety disorder and depressive disorder, and I cannot rule out the contribution of those conditions to some of these symptoms. But I also want to add these last couple of slides, long-term consequences of heat exhaustion. Everybody in medical school and emergency medicine training, when I was an anesthesia resident, we learned about, we had to learn it because of a condition in anesthesia called malignant hyperthermia, which we found was induced by a particular inhaled anesthetic called halothane. But those are the extreme cases of, if you will, hyperthermia or heat stroke. It turns out that there are some, at least intermediate term consequences of heat exhaustion. Chia and others studied neurologic complications of heat exhaustion in young, healthy military soldiers. And they did basically a case control study. They took all heat exhaustion cases diagnosed in a certain period of time in 1998 and compared them with matched controls for age, ethnicity, and military occupation, but soldiers that had not been diagnosed with heat exhaustion. And they performed a number of different tests. They did a bunch of neurobehavioral assessments, and they also did a postural stability study, which is basically a computerized way of looking at how steady you are on your feet and really being able to tell if you're just steady and you're able to stand there, or if you're constantly having to correct your posture because you're not quite as steady on your feet as you would like. What they found was 2 weeks after their diagnosis of heat exhaustion, the cases, the people that were diagnosed with heat exhaustion, had significantly higher prevalence or significantly more likely to have dizziness, dyspepsia or acid reflux, muscle aches and pains, headaches, inability to relax, irritability, and sleep disturbance. There were significant differences between the cases and the controls on multiple of the neurobehavioral tests. And I'm not going to belabor it. There was a bunch of them that they tested. They used a computerized neuropsychological test battery, and there were significant differences on a number of those. They also found that the cases, the folks that were diagnosed with heat exhaustion, had significantly poorer postural stability or balance than the controls. And that's 2 weeks after they were diagnosed. And so now they're out of the heat. They're not being re-diagnosed with heat exhaustion. They're not having a recurrent problem with heat exhaustion. What Chia did then is they assessed these folks for long-term consequences. And what they did is they looked at these folks using the same test protocol as they used initially at 3 months after they were diagnosed with heat exhaustion, 6 months, and 12 months after their acute episode of heat exhaustion. And again, they were compared with matched controls. And again, those matched controls were also looked at 3 months, 6 months, and 12 months. What they found was that there was still a significant difference between the cases and the controls on neurobehavioral testing and on postural stability testing at 3 months. When they looked at these folks at 6 to 12 months, they found there were no statistically significant differences between the cases and controls. So what that means is that even 3 months out from a case, a bout of heat exhaustion, a person may still have problems, as we've discussed, with things like balance, with coordination, with irritability, with heat intolerance, 3 months out from their exposure. But typically 6 to 12 months out, we should see a return to normality with those folks. So I just want to finish up with a couple of slides. One of them is basically for, a plug to remember, how to tell these two apart. Heat exhaustion, the big one is that their skin is going to be, cool and wet, sweaty, and they're going to be pale. Obviously, they have to have light-colored skin to be pale. They're going to be dizzy. They're going to be thirsty. They're going to be nauseous. They're going to feel weak. With heat stroke, they're going to be hot and dry of skin. They're going to be confused and dizzy. They may be unconscious. You may find the person unconscious on the beach, beet red, dry as a bone, and you can't rouse them. You need to get that person in the shade and start cooling them down. And obviously, you need to call 911 for that person. Lastly, preventing heat exhaustion. Please, light, loose clothing. This is not the time to wear the tights and, the real form-fitting clothing. Those are not a way of preventing heat exhaustion or heat stroke. Stay indoors like we're doing today. Yesterday was 100 degrees here in Missoula. Yeah, you want to stay indoors. You don't want to get out there in the sun. If you do have to be outside, wide brim hats are advisable. Sunscreen is advisable. Hydration, hydration, hydration. Avoid alcohol. Avoid caffeine. Take care of yourself. So with that, I'll open it up for questions.